Hello YouTube, welcome to Dr. Vibes, a learning point. In this video, we will study about how to manage a burn wound. Next, we will study about the management of a patient of burn. तो ये बहुत इंटरेस्टिंग पार्ट है. अगर आप इसको इंटरेस्ट लेके समझोगे तो सोचो किसी को बर्न हो गया है, बहुत सिवियर बर्न हो गया है. फिल्म्स में भी दिखाते हैं, सीरियल्स में भी दिखाते हैं. एंड इट कैन हैपन टू अ पर्सन इन रियल लाइफ ऑल्सो, राइट? तो आप कैसे मैनेज करोगे उसको? सबसे पहले तो बिफोर टेकिंग द पेशेंट टू द हॉस्पिटल यू हैव टू डू सम प्री हॉस्पिटल केयर. आप एम्बुलेंस का तो वेट नहीं कर सकते, यू हैव टू डू समथिंग देन एंड देयर. क्या करोगे? जस्ट थिंक. सो इफ द पर्सन इज बर्निंग, आप लोग अभी एक डंकी मूवी देखे होंगे, वहाँ पे विक्की कौशल he suicided by lighting himself up in fire. So what would have been done in such cases? So first you have to stop the burning process. So do you remember that Shah Rukh Khan took a blanket and tried to control that Vicky Kaushal was burning. So try to control that. So you have to stop the burning process, first thing. Second, if there is any other major immediate life-threatening injuries, then you have to stop that. So suppose मान लो एक patient का head injury हो गया है और एक patient का burn हो गया है. So first of all, after stopping the burning process, you anyhow have to stop the excessive bleeding because ज़्यादा severe condition है. Okay? Third, आप सोचोगे कि ये burn है तो चलो ठंडा पानी डाल दो. Never do that. Because that will lead to more aggravation of the symptoms. So, and also you have to prevent hypothermia. So you have to avoid hypothermia by preventing contact with the ice cold water. Yes, ज़्यादा से ज़्यादा condition में आप normal room temperature का पानी डाल सकते हो. Fourth point, you have to do supplemental oxygen to the patient. Okay? And fifth point, that you have to elevate the head end. Okay, head end को elevate करने से person better breathe in कर पाएगा, उसका condition थोड़ा better होगा. So this is before the ambulance comes in and you see a patient who has been burnt severely. You can do all these things. Okay? Burning process को कम करो, normal पानी डाल दो, other injuries को हटाओ, supplemental oxygen दो, and head end to elevate करो. Now usually the patient of burns come in the emergency. So in emergency or trauma, so normally in trauma you do A, B, C, D, E, right? Here also you have to take in consideration F, A, B, C, D, F. A, airway, B, breathing. So you have to do early elective intubation so as to stop the respiratory distress of the patient and to prevent the problem that the patient is facing due to breathing. Okay, C, that is circulation. So secure the white bone IV cannula and you have to start the circulation of the patient. D, as you know, is disability. See if there is any other disability in the body by Glasgow Coma Scale, and you have to do the exposure and to control the environment. Okay, F is the fluid resuscitation, which is the very important part. So here you have to know, you have to see, you will see that how much amount of fluid is given, to whom the fluid is given, वो भी देखना जरूरी होता है. Okay, now come to what is the criteria. Patient emergency में तो आ गया, emergency में you have done A, B, C, D, F. But what is the criteria to admit the patient in a burn unit? Okay, so there are various criteria. You have to remember this, very important. Adults, if it is more than 15% body surface area of the burn. For children, it is more than 10% total body surface area. Any full thickness burn, either 3rd degree, 4th degree burn, okay, which has involved your subcutaneous fat and muscles. 5th में तो person dead हो गया है, 5th degree burn में कुछ कर नहीं सकते. 3rd, 4th में you have to take into consideration. If the burn is involving the major joints, face, hands, perineum, admit the patient. Any chemical or electrical burn, any burn in which excessive fluid resuscitation therapy is required, admit the patient. Inhalation injury, क्योंकि person को respiratory distress भी हो रही है, admit the patient to the burn unit. Adverse psychosocial issue हो गया है, admit करो. If the burn has been at an extremes of age, बच्चों में हो गया या फिर एकदम old में हो गया, and if the burn has been without any accident, मतलब अगर जानबूझ के burn किया गया है, either suicide or somebody has planned to do that burn, you have to admit the patient to the burn unit. Now let us see कि क्या-क्या fluids लगता है. Now if you're seeing the pathophysiology video, you must be very clear with the concept कि burns में edema होता है, burns में hypoperfusion होता है of the vital organs. So our main goal in fluid resuscitation is maintenance of the intravascular volume so that the perfusion of the essential organs and the tissues can be made. Right? This is clearly written over here. Now, who needs fluid resuscitation? If you're an adult and you have more than 15% total body surface area of the burn, and if you're a child, you have more than 10% total body surface area of the burn, you will need fluid resuscitation. Now, before fluid resuscitation, which is given IV, a person can also be started with oral resuscitation with using ORS, and here salts must also be added. Now, and you will comment me in the section below why salts are added, right? Now, how much fluid has to be given? This is given by Parkland or modified Parkland formula. For the first 24 hours, you have to give 4 ml per kg per percent of the body surface area burned. So suppose there is a 50 kg person who has 40% total body surface area. So 4 into 50 into 40, 8000 ml. How will you give? Half of this 8000 ml is given in the first 8 hours. The remaining half is given in the next 16 hours. So 4000 ml पहले ही 8 घंटों में दे दो. And the remaining 4000 ml should be given in the remaining 16 hours. Now, calculation of the time is from the time of the burn, और जो टाइम हम लोग बोलते हैं ना फर्स्ट 8 आवर्स फर्स्ट 16 आवर्स, नॉट आफ्टर द पेशेंट हैज कम इनटू द हॉस्पिटल, बट जब से पेशेंट को बर्न हुआ है तब से करते हैं. ओके, व्हाट इज द फ्लूइड ऑफ चॉइस? फ्लूइड्स देना है, ठीक है, कौन सा फ्लूइड्स देना है? आईवी में रिंगल एक्टिव देना है. ओके, इन केस ऑफ पीडियाट्रिक एज ग्रुप, how much fluid is to be given? That is given by Holliday-Cigar formula. Okay, in which you have, if a child is more than 14 years, you have to give 2 ml per kg per total body surface area, and if the child is less than 14 kgs, then 14 years, then it has to be 3 ml per kg per total body surface area. Now, this is also very important. What are the indicators of resuscitation? You have to measure certain things. ये सब गड़बड़ हुआ तो रेसिसिटेशन शुरू करना पड़ेगा. Urine output, decrease urine output, okay? Hematocrit, if it increases. Arterial blood gas, if shows electrolyte imbalance. If central venous pressure. You do transesophageal electrocardiogram to see the cardiac filling pressure. Okay, so these 5 points have to be checked, and these are the indicators of resuscitation. So this was all about the management of the burns, which includes the pre-hospital care, the emergency care, admission to the hospital unit, and the fluids that has to be given.